You look nervous. How far along are you? I'm 12 weeks, and my OB says it's time to do some genetic screening. I'm nervous though. I don't know if I want to know or not. What if my baby has a third head or a tail? Well, there's lots of pros to genetic screening too, and cons. Okay, then tell me about the cons. What makes you so nervous? Well, it's a blood test and an ultrasound, right? I've heard that's not always accurate. They could tell me my baby is completely healthy, and then I'll be just as surprised when he's born with an abnormality as I would be if they had told me. Or what if they tell me he does have a problem, and then I get to spend the next 30 weeks freaking out over it? And then what if he's born without that problem, and I just wasted 30 weeks of freaking out and preparing for a completely healthy baby with none of the problems I prepared for, or a different problem? Alright, just take a deep breath. Anxiety is a completely normal feeling to have, so I understand where you're coming from. Only this first test can be vague. If they do see something they think might be a problem, there will be more tests later in your pregnancy to confirm it or prove it wrong and show you have a healthy baby. Plus, if you know now, you can get the counseling and advice you need to prepare and be ready for any problem they have. Well, maybe. But there's also the risk of miscarrying for those later tests. The amniocentesis and the CVS thing have a risk of 1%. That's 1 in 100 babies. I'm not willing to take that risk with my baby. They can do some more non-invasive tests like a nuchal translucency ultrasound to determine a baby's risk for Downs or other chromosomal abnormalities, and that test is non-invasive. But the later test won't be done until 15 to 20 weeks, and that decreases the risk to less than 1%. And with the ultrasound, there's only 5% false positive rate, so more than likely you won't receive a false positive result. Well, anyways, another thing is that screening isn't a whole body thing. They have to know what to look for. But I was adopted, so I don't know my family history, what to tell them to look for. Plus, employers and insurance companies have been known to deny individuals essential health care or employment based on knowledge of genetic disposition, which is ridiculous. But have you heard of the Genetic Information Non-Discrimination Act of 2008? It prohibits employers using that data to hire, fire, or promote, and health insurance companies from using it as a pre-existing condition. Hey, Miss Heather, are you ready for your appointment now? I guess so. Thanks for talking it through with me. I think there's more to think about now.